Howdy, folks, and welcome to another Accessibility Talks, or Alley Talks if you want to call it that way, a monthly virtual meetup where we chat about digital accessibility, inclusivity, and usability. Each month, we invite a speaker to present a topic, and afterwards, we invite the community to ask some questions and participate in the discussion. I am your host this month. I am Mark Casillas. I live in Albuquerque, New Mexico, and I work at Lullabot. I use the pronouns he, him. And if you want to describe myself, I would say I'm a male with glasses and a beard wearing a blue t-shirt. Slide. No, I said slide. Thank you. Before we get too far, we have live transcriptions. If you want to go to bit.ly, bit.ly, and then /Alley Talks live transcripts, that's A11y talks. You can look for the link in the chat, which should be coming up shortly. And you can also enable YouTube closed captions if you so desire, and if that works best for you, of course. Let's take a moment to remind everybody that our group seeks to provide a friendly and safe environment. We require all participants to adhere to the Accessibility Code of Conduct, or Accessibility Talks Code of Conduct, that is. This includes speakers, the host, those watching on YouTube, anybody commenting on the social networks, and this applies to all community interactions and events, verbal questions in chat. And if you want more information about the Code of Conduct, you can go to alleytalks.com/conduct. All participants should be able to engage in a productive dialogue and share and learn with each other in an atmosphere of mutual respect, please, and thank you. If you have any questions, we love the questions. So at the end of the presentation, we're going to do some Q&A. If you have a question for our speakers during the talk, a couple ways you can ask. You can either chat in the YouTubes there on the somewhere over here, I think. And then if you want to go to Mastodon or Twitter, use the hashtag AlleyTalks. That's A11yTalks on Mastodon or Twitter, and we will pick them up there. Big shout out to our Agile Collective for being our bronze sponsor. We very much appreciate your support. I want to give out a shout out to the Alley Cat Club members, which I don't have my Alley Cat Club t-shirt on because it's dirty. But if you want to donate monthly to Alley Talks, or you can be a one-time donor or a monthly donor, we very much appreciate your financial contributions. If you want to sponsor us, head on over to alleytalks.com/sponsorship for more details, and more importantly, to see what we're doing with all these great sponsorship that you are providing for us. Benevity, we also have a new way to give. Our company uses Benevity for matching donations or gifts, so you can double your contributions. Just search for Alley Talks, or it should also be Alley Talks by the Midwest Open Source Alliance, or MOSA, if you are using Benevity. All right, let's go ahead and get into our talk. Chanda Hinton. I keep adding L's and R's into your name, and I don't know why it is. She's a senior executive director of Chanda Center for Health. How are you?
I'm good. I'm honored to be here. Thank you for having me, and I'm excited to talk about accessibility in healthcare and how that's associated to some digital components of it, but also some very physical and much needed discussions for people with disabilities.
Beauty. We do like to embarrass our guests with some fun facts.
Oh, great.
And your fun fact that I have written down is that you love cheesy 80 flicks. Are we talking Aliens, or which one are you talking about?
No, like the I would probably say the rom-com 81s. I think being born in the 80s, there's something about the 80s that just always the colors and the fads and all that kind of stuff. So I'm into that. Even when there's like remakes these days and they use the 80s theme, it's just like, it just feels a little bit like home. So I'm proud of that fact, right?
Very good. Yeah, no, that's a good one. All right. So you're going to be presenting today on Breaking Barriers, the Fight for Disability, Competency, and Health Equity. So the floor is yours, and have fun.
Thank you. Well, thank you again for having me here. I'm excited to talk about the breaking healthcare barriers for people with physical disabilities. And this has become a part of my personal passion, as well as my personal career. And it's very much focused in healthcare, because as an individual, I live with a spinal cord injury, I live with a disability, and I will get more into the specific details around why it's become a part of who I am personally, as well as my profession, and some exciting things that I think that are on the horizon, that have been changed, that have been adjusted in order to break down those barriers, at the same time having a realization that there's a lot more work to do. So with that being said, again, I'm the senior executive director of the Chanda Center for Health, and let's kind of jump into it. So for me, the meaning of healthcare, I think that oftentimes we look at healthcare as this industry that is much about medications, being in the hospital emergency room. And I think that as individuals with disabilities, we can often spend a lot of our time in those spaces. I think that when we stop using or viewing healthcare in a capacity where we're looking at the proactive and preventative components to healthcare, and the things that are about moving your body, what we eat, how we move our bodies if we're unable to move them. So looking at healthcare in a more proactive and preventative capacity versus a more reactive capacity. I will say that oftentimes when we live with disabilities, we are not only forced into a healthcare model that feels reactive, because that's just the industry of healthcare overall. But I think that when you come into that world with a disability, it's even more difficult to be connected to the preventative and proactive components. The example that I'll give to you is that, regardless of having a disability or not, how often do we have talks about how we move our bodies, what we eat, with our physicians or folks in the healthcare industry, regardless of having a disability? So that's very minimal. So when you add the layers of disability, secondary conditions that come with that, oftentimes it makes those conversations even more difficult to have. The other component I would say to that as well is, not only does it create a more difficult reality, there's oftentimes in the healthcare industry, which continues to blow my mind today, where providers aren't comfortable with disability. They don't know how to approach disability. They don't know how, some even might have the belief that disability can't be healthy. When you put those disability and healthcare, or disability and healthy together, people often see that as, an oxymoron. Like, that can't be the reality. The reality is that disability and wellness, and disability and healthcare, can absolutely coexist. And why is the conversation regarding that, based on all the layers that I've already shared, not occurring? So that brings a lot of layers to the conversation, right? Because there's lots of historical components around those those conversations, which then reduce some of the ability to have access and accessibility within healthcare too. So I think that as we, it'll be interesting to have a little bit of Q&A at the end to see how others have experienced some lack of accessibility as it relates to not only the definition and meaning and relationship with healthcare, but how they might experience that as it relates to their disability, and their relationships in terms of partnership in our healthcare. Meaning, like, maybe we look at our physicians as our partners in healthcare, rather than somebody that is not a part of that conversation, and can be, it feels better to have a partner in that, rather than feeling as though you're kind of having to constantly convince people that disability and wellness can coexist. So I'm going to start back up a little bit and share my story, because I do believe that this really feeds into why I'm having this conversation and with you today. And so when I was 9 years old, and I will also show a video a little bit later, which kind of goes into some more in depth. But when I was 9 years old, I was accidentally shot in the back of the neck. So it severed my spinal cord between the C5 and C6. I operate and function daily with the use of a power wheelchair. I have an adaptive vehicle. I have home health care attendants that come into my home morning and evening to help me do my activities of everyday living. I have a beautiful service dog named Bampton, and that's how I function in the world. How I've gotten to this is that through the reality of that injury, um, I was thrown into the medical model. My relationship with healthcare began when I was 9 years old. And as I mentioned, when we have injury or we have disability or diagnosis, we instantly, without even really wanting to, are thrown into healthcare because that's just the part of what comes with that, right? So with my spinal cord injury, that's my primary disability, and then I have all these secondary kind of secondary conditions associated. So bladder, bowel, muscle spasticity, maybe some nerve pain. So think about primary disability, secondary, and those secondary conditions. Unfortunately for myself, they were addressed by Chanda. Here's a medication to address this. Here's a medication to address that secondary condition. So the list of secondary conditions almost equivalated to a medication being given to me to address that. When I turned 21, I started having severe chronic pain. So the direct way to address that was a surprise, another medication. That unfortunately, it became a narcotic that was provided because in 2003, that was the peak of the opioid epidemic, to where my pain was this. Oh, that's another secondary condition. Here's your opioid. So I started utilizing opioids, not even really understanding that they were only for short term. They're not long term, and there's other ways to really be addressing that pain other than just resorting to medication. So again, what was the conversation? What was the partnership that the conversations that could have had around what are some of the other alternatives that Chanda could utilize in this particular moment rather than only that option? That right there is another example of what accessibility looks like in our lives around healthcare. That medication, unfortunately, sitting in my wheelchair for 21 years, taking all that medication, not doing anything proactive or preventatively, I got very, very sick. I became bedbound. I was 59 pounds. I had to be hospitalized. So it was very interesting to look at the circle of my kind of, I would call it a vicious circle in a way, is that I used the medical model and to intervene and save my life when I was shot. And here I was using the medical model to again intervene and save my life, but not due to being shot, but due to the overutilization of the medical model. So when I was hospitalized, I was being fed intravenously, I had a feeding tube put in, failure to thrive. That's what a lot of individuals shared with me during that time. And again, it saved my life. But when I got done, I had a conversation, and here again is that exciting component in my life where I looked at my physician and said, "Hey, let's have a partnership around my disability in healthcare, and let's redefine how we approach it." And my sister was also very instrumental because she was a yoga therapist at that time. So she really introduced me to how about we address Chanda's secondary conditions with acupuncture, massage, chiropractic, physical therapy, the things that her body did prior to disability, but due to lack of movement, can't do that now. It doesn't mean that I have to be removed from all types of medication, but allowing myself to embrace the reality of my limitations with my spinal cord injury, the accessibility of the medical components to my the healthcare that were helping me as a result of my injury, but then also being aware that there was a pretty significant missing component, which was this proactive piece of it. I think most of us will understand that accessibility to movement is difficult because when you have a long-term disability, whether it was due to an injury such as myself or due to diagnosis at birth or diagnosis later on in life, that we can't just go to the gym and move our bodies. We can't do some of the various components, or whether it be transportation, whether it be actually physically moving our bodies. We have to be aware of the boundaries and accessibility around moving our own bodies. And so how do we incorporate being proactive and preventative with that reality, right? So when I started utilizing these therapies, at first I was like, oh goodness, like, I came from a very rural, small town. And so I often had thought about those therapies as being very like woo woo or weird. And there are people today that still can kind of see some of those services, or they look at them as luxury services, like I'm going to a spa for massage. What I can tell you is that they've become very instrumental in my life. They're the reason why I'm on this or we're having this conversation today. I started doing those services and it dramatically shifted my healthcare. It dramatically shifted my mental capacity to I would say that I was alive and I was living happy, but I wasn't living with a level of determination, vibrance, and vitality to the point that I was able to be passionate and do things that I wanted to do, because I always felt like I was fighting to stay healthy. So, with that being said, which I'll kind of pause there because I want to then kind of move into some components, which we'll talk about how did we address some of those pieces, not only for myself, but how did we address that for other folks. So we've talked about healthcare barriers overall. We talked about the relationship, the definition of healthcare. We've talked about lack of movement. I think one thing around healthcare barriers is also what is there to be if we have, let's say, lack of ability to move, and acupuncture, massage, and chiropractic is beneficial. Then it comes down to, how do I afford that, right? How do I sustain the ability to access these services, knowing that they could dramatically change my life and sustain the wellness to the point where I have multiple options to address my pain rather than just a medication. So one of the things is being aware in the healthcare field and industry that it's not around attitude, it's also around funding, and it's also around the accessibility of how do I get there and how do people really understand what I'm going through. So I'm going to kind of give you we're going to go to this component of summary of the barriers, right? So we have barriers around accessibility to buildings. We have oftentimes when I go into any sort of clinic, even though I'm breaking down the barrier of being able to access preventative health care and have funding to access those things, it doesn't mean that when I show up to then get the services that it's going to be a breeze, right? I still have to get into the building. I still have to check in at a registration or at the desk, which oftentimes you may not be seen. You could be sitting behind a reception desk because they're always so high and nobody really notices you. There's oftentimes, if I go into a treatment room, I don't get transferred onto a treatment table. I don't have a physical and annual exam. I don't get preventative screening because people are so very much used to addressing my secondary conditions. And both, Chanda, let's deal with your urinary tract infection or your bowel issues or your pressure sore. But what about all the things that come with just being a human? What about, pap smear, breast exams, other things that we all deserve to be screening and be aware of to ensure that we're healthy. And then also, we all know that when we go into healthcare, they're always like, what's your height and your weight? And you're like, well, do you have a wheelchair scale? Do you have an ability to weigh me? Because that fluctuates for all of us all the time. So these are pretty significant barriers. And when we have these significant barriers, when we don't address them, we're costing ourselves socially, because when we're not healthy and we don't have the ability to sustain wellness, who wants to be a participant in life? Who wants to be, being or with family, friends, doing all these things in life if you don't feel good enough to do them? So while there's that social component and cost, there's also of actual direct cost where individuals don't get physical, when they don't get a physical exam, when you don't catch the risk of having cancer, but you're not aware of it till much, much later because there was no screening. There could be medication errors. If you never know your weight, who's to say that you're not getting any type of medication that you could be potentially overdosing on something? There's been a lot of stats that show that there has been multiple in the disability community, a lot of unfortunate risk and death when you don't weigh yourself as it relates to certain medication. When we are often over hospitalized or use the emergency room far more than we should, because we should be seeing our primary care physicians rather than resorting to the ER or the hospital as our primary care physician, because oftentimes we don't always feel so comfortable with our physicians, which then results in no treatment. And this all sounds so bad, and I promise there's going to be hope and some good things that come out of this conversation. So I don't mean to paint such a, sad picture, but it is difficult. I think it's a difficult conversation that we all have to have around disability, accessibility, in healthcare. And the good part is that we have some good stuff to share. So let's get into that part of it. So one of the components is that in our healthcare, which I might want to show the video here first. Hold on one. So yeah, nope. Let me come back to that. So in healthcare, we notice that all of that stuff is not okay. And one of the unfortunate components within all of what I've shared is that there's very little regulations to monitor this, to audit it, and change it. We have the ADA, right, the Americans with Disabilities Act, which I'm older than, if you can believe it or not. I'm in my 40s, and so the fact that I'm older than the ADA, and it's very clear that there is not a very direct way to monitor the awareness around being proactive with disability, the ongoing barriers, and the enforcement to ensure that people with disabilities have access to equitable healthcare, and that they're getting all those things that I just shared that are ongoing barriers. And so with that, we are doing a lot of advocate work to ensure that those components can change for people. And I think that what I'll jump into next is, how are we doing that? And so because there is basically my next slide. So basically the equitable healthcare is possible. The reason why I say it's possible is because I think that when I paint such a large picture of how can it be possible with all those barriers and lack of enforcement and lack of auditing, I think that even myself, and creating an organization, the Chanda Center for Health, and looking at how can we be giving people direct services to give them preventative care, but how are we looking at this from an advocate and systemic level? So with that being said, it's possible, and let's jump into sharing the video so we can show you some of the things that can be created and changed.
When I was 9 years old, I was shot in the back of the neck by a .22 rifle. And so that severed my spinal cord. I don't have mobility from basically my armpit down. So when I turned 21, I started having pretty severe chronic pain. I got so sick that I became bedbound. I weighed 59 pounds and I had to be hospitalized. And that's really what sparked a much deeper conversation about weight. We need to really redefine the way that we're approaching Chanda's spinal cord injury. And I tell people every day that integrative therapies absolutely saved my life and continue to save my life. And now I want to make that available to other people. That was kind of the birth of the Chanda Center for Health, all underneath one roof. We're offering acupuncture, massage, chiropractic, physical therapy, care coordination, behavioral health, dental services. We do that with the lens that the services in our space are therapeutic.
I often observe people who are really just surviving day to day because of the challenges of their health needs or their disability. And I really see the work that we're doing as work that are helping people get beyond those basic needs and concerns to a higher level of actualization in their life so they can be more engaged in the community because they aren't suffering from crippling pain every day.
And now Colorado Medicaid is funding acupuncture, massage, chiropractic, so that folks that live with injury or disabilities, we're ensuring that it's equitable and it's accessible for all.
We went to a neurosurgeon and they determined that it's spinal stenosis. Post-surgery, I continued to get worse. And I pretty much had given up. I was getting worse and worse and worse. It's the most depressing feeling in the world because you don't know what to do. You don't know if this is it. I was preparing to die. I found the Chanda Center. Chanda Center gives you a reason to get up, gives you a reason to get moving, to feel good about yourself. It gives you hope.
Before coming in for services at the Chanda Center, I felt hopeless. I've had quite a bit of back pain, which being able to get massage has helped with that. Having acupuncture help with stress and depression. It's really enriching my life here at the center.
There's no place else you can find the resources under a roof. Massages help you?
Yeah, it's helped me a lot and made me stronger.
I can't do the things that he needs at home. He needs the people at Chanda to be able to get him out of his chair and give him a quality of life that he deserves. And it's really important for us to have this center.
It's important that the donors know what the impact is. You're the heroes.
I would encourage you to give sustaining support to this program that can help those of us that have these challenges so that we can live as productively and engaged in society as possible.
I want to thank all of you because you mean more to us than you will ever know.
The donors that made this place possible, I
We-
would like to say thank you.
And we could probably, thank you for, I'm excited to share that video. We use it for various things. So it wasn't meant for any sort of pitch. That was just for us to kind of summarize our organization in terms of how we can take a very difficult situation and be changing it for good, creating hope, creating change in a healthcare system, creating accessibility in a healthcare system that otherwise can feel completely not like that, right? Can feel very daunting at points. And so through that, what you will have heard is that we've created the ability to really have the change in healthcare where now we have funding streams for preventative healthcare, right? Here in the state of Colorado, we went to the legislative and we created funding underneath Medicaid for those preventative services. So again, changing the conversation about let's not just only use medication, but let's use proactive services. The other component is that at the Chanda Center, when we're looking at our slides, we're very therapeutic. We have lots of accessible parking. We have accessible bathrooms with the dignity around you can go into the actual bathroom and you can shut the door and lock the door with a button and know that you have the dignity of being in a space where it's like, wow, I feel very welcome here. I'm not going into a place to access healthcare where it actually feels like I don't belong. I think that healthcare is one place where we should all feel like we belong and have access to. At the Chanda Center, what you would have probably saw in the video is that we can wheel up underneath a counter at the front desk and have eye-to-eye contact with the person that is scheduling our appointments and helping us navigate our resources through care coordination. We have a wheelchair scale. We know our weight. We know that we deserve, as we were saying earlier, we have the right to know that from the capacity of like what kind of nutrition or weight control do I need, whether it's gaining or losing weight. We have height adjustable tables, and we've trained all of our providers and staff on how to do transfers from our wheelchairs to the treatment table. If you're not in a wheelchair, all of these things are still accessible to you because let's be honest, we're living in a world where disability doesn't discriminate. We all will at some point as we age or have temporary or long-term disability. And so when we can get really good at complex healthcare and address disability in the ways that the Chanda Center is, we can make healthcare better for all. In our treatment rooms, we have a voice command control where people, if they're in their room, they can actually say, call the front desk, and somebody from the front desk can come in. So it's feeling also safe in a space of healthcare. And we have ceiling lifts. And so that way people, even if it's difficult to transfer, we can do that safely without hurting our providers and our participants that we serve. So with all of those, the summary of how we can make healthcare accessible being reality, we're a grassroots organization. If we can do this, big systems can do this and should be doing this. So I will conclude. I might be concluding a little bit earlier, but that always offers opportunity for some Q&A, some maybe discussion as well. What I will leave all of us with is that let's be a part of building a world where healthcare is accessible. Whether you're an individual that just wants to advocate for yourself, that's okay. You don't have to be out advocating for all people with disabilities. Not all of us have the desire or capacity, but make sure that you're standing up for your healthcare and access to the barriers and point them out, right? I think sometimes in healthcare, there's a little bit of gaslight where we can often be told that what we're feeling or seeing is in our head. And it's kind of like, well, if we feel as though that we're not being treated well in healthcare, how is that not a reality, even if it's what our individual personal experience? If you're an individual where you feel as though you have the capacity or desire to advocate, be aware of your own individual state and the legislation and opportunity to make these services available for other people in other states. And be sure to keep your own providers and other providers accountable. I think that if anyone in the healthcare industry is listening, whether you're a provider, whether you're a part of a clinic, these are things that you can take on to ensure that you're creating an equitable healthcare for an accessible healthcare for others. And I think those that are in positions of power that already exist within various system changes legislatively, you can be an advocate for your own healthcare, because I do believe that this is not about, again, just disability. This is absolutely about all of us in our healthcare journey, and realizing that when we fight for the complexity and making that easier, we make healthcare accessible for all. So thank you so much for having me, and I'm ready for some Q&A.
All righty. Thank you very much for that great presentation. Love the video. It was very, very, very moving, very well produced. I appreciate it. We do have a bunch of questions, some that came in through the YouTubes and some that came in through ourselves. And they should be being posted. There we go. Which particular therapies have you benefited the most from?
That's a great question. And a lot of people ask me that question. And I always tell people that each of the therapies do something a little bit different for me. So physical therapy is really that movement, right? Whereas massage really deals with my lymphatic drainage, muscle spasticity, muscle tone, whereas acupuncture really kind of deals with that chronic pain and my digestive system. And so for me, there's never been one in particular that I would say is the one that's been most beneficial, because they do so much different things to my body. Granted, I will say that massage is probably the one for me that I have to seek the most, because I do feel like the prolonged impact that it has on me, meaning that I can go several days without having pain, whereas like sometimes maybe the other ones maybe don't have that most prolonged effect. But again, it's always realizing that you've got to sustain those things and continue getting the service.
Excellent. Thank you very much. Our next question popping up. In what ways do you engage the accessibility community online?
Yep. And I love that question, in the sense that, that's part of what you all do, right? And so I think that digitally we're doing as much as we can to ensure that we are, being available, obviously accessibility in terms of website, making sure that we're looking at more remote educational options, as well as more support groups that are online. And so anything that we can do that really creates a digital footprint, a digital awareness, a digital educational opportunity, including today being here with all of you, is something that's always on top of our mind. And realizing that another example is healthcare and telehealth, digitally making sure that people have access to their providers and services through digital components that don't always require people to have to be in a room for some of the services that could readily and quickly address something without having to deal with non-accessible access to things.
Cool. Yeah, and I'm noticing in the notes here that you have Instagram at Chanda Center for Health. You have the LinkedIn as a company, the same thing. YouTube channel, which has a big long array of string that's hard to read, so I'm not going to. But also you have Facebook as well. So if y'all want to reach out to her or them there, feel free. All right, next question. What kind of difficulties do you have being heard by the medical community?
I would say that the value and I would say validity around integrative healthcare, right? I often hear as though acupuncture, massage, chiropractic there's no evidence, there's no research. Well, there's a lot of it, right? And so I think that while we're progressing in a world of healthcare, at the same time, we're still having to come up against those biases around those services being valid, and also around the biases that people with disabilities can be healthy and have the right to be healthy.
Yeah, definitely. Yeah, going through some things myself and having people listen to like, what else can we do is always not fun. So how can I find out in my state if these types of services, acupuncture, massage, etc., are available and covered?
Yeah, so it depends on your coverage, right? So a lot of our participants and our services are, as we know, most folks with long-term disabilities have to resort to some sort of state or federal assistance, such as Medicaid. And so in Colorado, if you have a case manager that oversees your long-term support services, they would know, right? They would be the ones to say, hey, is there any particular services? Am I on the right particular? Some states will have waivers. We have a lot of home and community-based waivers. And so case managers are typically the ones that should absolutely know, and the broker of your services. Outside of Medicaid, that would be something that your coverage, you would just reach out to your insurance company and inquire about that. And then, of course, we always have a playbook to say, hey, if it's not covered in your state and you want to advocate and create reality for that, we do have a playbook to support advocate organizations and individuals, how they would go about doing that. I think that we have to realize that we in each state are living in different political realms, where sometimes the difference between Medicare coverage and what it covers is going to be different, obviously, per state, because that's also CMS is a federal level, and then states decide what they want to do on Medicaid state by state versus Medicare being federally. And that was probably a boring 101 on that, but that's probably the best way to look.
All 101s are boring, but very necessary. So, what can you do? All right, next question. For someone going through something similar, what advice would you give them to get through?
I would remind yourself that you're not alone. I think that that's always been one of the motivations for me, is that what's that quote and saying, is that we're all alone in this together. And so while we have our own individual journeys and we're all dealing with our either disability or access or in our own individual way, I think the most comforting thing that has been for me is to realize that I'm not alone and that I have people that are advocating and fighting for my needs. For example, I'm a strong disability advocate for healthcare, but a lot of what I get to experience in healthcare today is due to the disability advocates that came before me. And so I, know that things will continue to progress and ebb and flow, and we just can't be discouraged, and we have to keep kind of pushing the envelope.
Awesome. Thank you. Thank you for that. Next question: are you able to share that playbook that we were just talking about? This question came up quick after you mentioned it. Is it online or something other people can request?
Yep. Yeah. So I believe I can put my email in the chat as well. Chanda@chandacenter.org. Yes, this playbook is basically just a really great 101 on how we pass legislation in the state of Colorado, the tactics that we took from, getting a legislative sponsor in the House and the Senate, granted knowing that every state's a little bit different, right? But, all the various strategies and how we went about doing it, we can absolutely share. And we're excited when people reach out to us and seek that information, knowing that they can create an impact in their own state as well.
Yes. Awesome. Thank you. Next question: is there specific legislation some folks should support? This is the day after an election, so kind of hard to say this, but is there something that you're looking at during the election time and hope that you see the good results from?
Well, there wasn't anything dramatically currently, but I do know that one of the biggest changes that recently has come down the pipeline is that their section 1557 of the Affordable Accountability Act, Healthcare Rehabilitation Act, is that there's a section now that is now requiring healthcare entities that receive Medicaid and Medicare funding to have equipment. And the piece of it is now to enforce the auditing and monitoring of that. So that again goes back to that barrier where it's awesome to have the ADA and sections of the ADA that require all these things, but then how do we ensure that what is required is being followed? And so that was the biggest component that I feel has been a pretty dramatic change in access and healthcare.
Beauty. Next question coming up: how does one donate to your center?
Well, you just go on our website and you make a donation. And again, I realize that Alley Talks is also, you guys are a nonprofit as well. So I always think that because of your ability to listen to my story today and other people's presentations, is that I really encourage you to be supporting them so conversations like this can still continue as well.
Well, thank you very much for that. That's very appreciative.
Yeah, of course.
Next question is: who were the support systems in your life during this life change? Who did you help lift you?
Yes, it was definitely my mother and my sister. They are the two prominent individuals, strong women in my life that have not only helped me navigate that particular situation, but they're so ingrained in my current everyday to day life. And so I'm very fortunate. I think most people with disabilities are very, very fortunate to have levels of network. I also realized that as the Chanda Center has been around for it'll be 20 years next year, is that we have a lot of participants that unfortunately don't have that level of support and network, even if they do have family members that don't participate in their lives or support them in the capacity that I am so fortunate to receive. So I always encourage individuals to obviously, if you have the ability to sustain those relationships with family and friends, but also seek it out with people that don't always have to be family and friends, right? Like we get to create who our family is through our own definition. And I think that it's really important to be aware of support networks that you can in order to, be able to feel supported, because again, we're all alone in this together.
Cool. Thank you. Next question. We just got a couple more here. Got about 15 more minutes as well. Has your organization been able to reach outside of Colorado? And if not, how can people help with that?
Yeah, so we've always been in Colorado. I know that we are in a current path of looking at how do we expand outside of Colorado. I think that there's been discussions about, do we do that as an organization, meaning like, do we set up the structure of going into other states and passing legislation, or do we collaborate with advocates in those states to make sure that they're involved? And so our board of directors and our strategic plan that we've built just recently is kind of creating an analysis on that to know what over the next 3 to 5 years that looks like. I think that one of the things that we've realized as an organization is that we're one of its kind, meaning that we've done research and through feasibility studies and all sorts of things to identify, is there other organizations like us that exist? And the answer is no. So that makes it very difficult in the sense that this is a model that does need to be replicated. This is a model that needs to be supported and available, not to just people with disabilities, but for everyone. And so we realize that sometimes we have been kind of the best kept secret in a way, which puts a lot of pressure on us, and at the same time puts a level of reality that we need to do. We have, again, a lot more work to do to make sure that Colorado is not the only state that has this level of accessibility in healthcare in it.
Yeah, I'm wondering if there isn't something that would kind of be able to organize in the different states things like this. And I don't have an idea of what that would be, but it'd be nice to have kind of an organization on top that helps disseminate funds and support and share ideas throughout. I mean, you're doing a great job in Colorado, which is close to me, so that's great. But there are other people in, say, Wisconsin that are not getting this kind of support that possibly would need that. That would be a great, that would be a great idea for everybody out there in the YouTube's land to maybe let's start that. Okay.
Yeah, I mean, I think about coalitions. I think of disability coalitions, and realizing that yes, each state we have our advocates, but it's like I've even tried to find, is there a disability health coalition where there's this level of awareness to tackle disability and access to preventative health care, as well as the physical barriers. And it's just one of those things where I feel like, oh my goodness, like I'm still kind of up against the government in a way to say, wait a second, like it's awesome that we have the ADA, but it's not enough. And so it's kind of like, it's a lot. And I love what we do. And I also at sometimes I'm just like, wow, this is a lot. There's a lot to take on. But I think that that's what also keeps us going, is realizing that there's so much more to do.
I was just going to say, well, we kind of have the ADA, but they are too staunch in their regulation, and we kind of need someone scrappy. I hate using that word, but that's kind of what we need to do. So
and not making the ADA live in the hands of or having the enforcement live in the hands of civilians right now, meaning, like, for example, if someone's not in compliance with the ADA, it takes people with disabilities to have to file a complaint. Like, to me, that's crazy. And that we would have to do it in healthcare makes it even crazier. So, it's very interesting. And I will also say we've come a long way, meaning that I sit on here sometimes and I may preach to the reality that it's not good enough, but I also want to be mindful that like I'm also very grateful to be on Medicaid and access services that otherwise I wouldn't. So I'm taking notice of the things that we do have and the things that need to be improved.
Yes, definitely. Thank you very much for that. All right, next question coming up. Are there websites that you regularly use and consider helpful and accessible?
That's a great question. Their websites, I don't. I'm just being
You hear
honest.
that, internet? You're failing. Oh,
Yeah,
wait,
no, sorry. But what about if you were to answer that question, have you noticed is there some sort of is that a
I mean, lately I've been doing a lot of VA websites, which are very, very hard to navigate through. So no is my answer as well. So, but you have, you have there are variety out there, but they're also heavy as far as like the wording of it is very hard to like sort through and try to find specific things, and you can't. It's not very searchable, stuff like that.
Yeah, and I wonder one of the things, and I don't know if you guys had other people that's presented on this topic, but like, has the requirement around accessibility on websites been beneficial? I mean, again, I know that this is something that's going to be demanded or there's a requirement in 2025 for that accessibility on websites. But I've also heard that what is identified as accessible through those, I guess, plugins for websites and things is that oftentimes, again, it goes back to, well, what's being identified as accessible versus not really being accessible. So I think that I think that this question is a good question in the reality of like, there's nothing that I go to right now that's like, oh my goodness, this is really accessible. But I hope to see more and more of that become a reality so that this question is going to be much easier for us to answer as we move forward.
Yeah. And I'm not even talking mechanically accessible. I'm talking content accessible.
Got
the
it.
content goes in circles for me. So so let's work on that, kids.
Yeah.
So, what overlaps do you see between physical and web accessibility not being addressed? We kind of just talked about that, but that's the same question. What overlaps do you see between the physical and web accessibility, like not being addressed towards you?
Yeah. I mean, I would say what we just discussed, I think, is one piece, and then I think that I know that when we're trying to search for providers, whether it be that we want to access them virtually, telehealth, or in person, I think that one of the pieces is that we're even finding that oftentimes we can't even identify virtually online whether somebody's physically accessible, right? I think so. There, and then I think there's a list of, again, what are we identifying as accessible versus not accessible? Because I think that some people identify accessible as like, oh, we met the code, right? But it's like, no, accessibility goes beyond the code. And so I think that us continuing to evaluate, or not evaluate, but I guess elevate what that accessibility is and keep people accountable to it is going to be really important to really answer and address this question.
Awesome. Yeah, thank you. So what are some of the positive experiences that you've experienced?
I know I sound like my presentation is probably like, you're just so negative. I promise I'm not a negative person. So some of the positive experiences is that the reality that we've been able to create a nonprofit organization that has the level of support and the level of impact creating, legislative change. Oftentimes, like, that's not an easy thing to do, to get Medicaid to cover the services that we've had. So even though, there's still there's significant barriers, the positive experiences that we've been able to actually create an organization and create legislative changes in order to fund these services. I think those are the most positive experiences. I think that that's showing us that we're on the right path. We're doing the right thing. And, you know, it's not like none of us are immune to barriers, right? It's just that I think that people with disabilities, we unfortunately have been not a prominent discussion in the the disability inclusion and it's EDI, or we forget about the accessibility. We all know that there's the DEIA, we forget about the A and the accessibility to it.
Yeah, thank you. Awesome. Thank you. Thank you for your sharing, and thank you for your story, your passion behind your project, everything you've been doing to helping others in Colorado, and hopefully we can expand that out. I've certainly learned a ton. The others our team chat have certainly been typing a lot of very positive notes and whatnot. So appreciate your time today, and thanks for coming on to be with us as well.
Thank you.
So going to continue on with the final notes. We are looking for speakers. We have we have a couple coming up that we're ready for, but we're always looking for more. We make a conscious effort to include marginalized groups in tech in our speaker lineup. And if you're interested, you can email us at team@alleytalks.com. That's A11y talks.com. So please let us know if you have something you want to say and want to share with us. For those of you participating with IAAP certifications, Alley Talk speakers and attendees all receive professional development credits through IAAP for your continuing education. And of course, if you have anything else you want to share with us, please reach out to us on the Mastodon. I think we're on LinkedIn. I think we're working on being on LinkedIn on ourselves. We have the Twitters and whatnot, and reach out to us and let us know. We hope that you enjoy us. If you want to follow us and subscribe to us, like I was saying, on YouTube, where you are now, or possibly are now, we're Accessibility Talks on YouTube. Twitter and X, we're at Alley Talks. And then on Mastodon, we're at Alley Talks at mastodon.social. And thank you very much for attending, and we'll see you next time. Thanks for playing. And now it's the time where